Welcome to Logic Medico. Today's interesting topic is difference between benign tumor and a malignant tumor. So let's start with a microscopic difference. There are 10 different microscopic differences. So let's start stepwise. The first difference is with respect to differentiation. So most benign tumors are well differentiated. Now what does it mean? It means we can distinguish the connective tissue from the epithelium from smooth muscle or a bony tissue, meaning the cell of origin is well defined. So that is called as well differentiated. Whereas in malignant tumor, it can range from well differentiated to poorly differentiated, meaning you can see in this picture, we can't make out whether the tumor is arised from an epithelium, connective tissue, smooth muscle, or a bony tissue. That's called poorly differentiated. In few cases, it can be well differentiated and moderately differentiated, where the cell of origin can be traced out. So that is the first difference. The other feature included in the same context is anaplasia, which is absent in benign tumor, but anaplasia is characteristic feature of a malignant tumor. So what is the meaning of anaplasia? Meaning the immature group of cells, the falling backward. See, we have mature cells in all tissues. Instead of having mature cell, the malignant tumor has got immature cells in abundant quantity. That is the meaning of anaplasia. Come to the next difference is about the nucleus. The nucleus, the shape of the nucleus, the position of the nucleus is normal in case of benign tumor. Whereas in malignant tumor, we can see the color of the nucleus is more dark staining. We can call it as angry looking nucleus. It's called hyperchromatic nucleus. This is due to the condensation of the chromatin, and the cell is highly mitotically active. So therefore, we can see in malignant tumor an hyperchromatic nucleus. What about the nucleoli? So the nucleoli is absent in case of benign tumor, whereas we can see a prominent nucleoli in case of a malignant tumor. Sometimes instead of hyperchromasia, we can see an irregular outline of the nucleus and even crumpled appearance of the nucleus in case of malignant tumor. So what are the features in nucleus? Hyperchromatic nucleus, irregular outline of the nucleus, prominent nucleoli in case of malignant tumor. Come to the next difference is called pleomorphism. That is not clearly seen. In benign tumor, it's not present actually. So what is this pleomorphism? Pleomorphism means you can see it's present. So you can see it's the cells of various shapes and sizes, right? It's like a chameleon changing its color. So pleomorphism of the cells as well as the nucleus is a characteristic feature of a malignant tumor. Pleomorphism just means that the cells are of different sizes and shapes. We can't make out the cell of origin. Next difference is with respect to mitotic activity. The mitotic activity is rare. Even if present, it is bipolar in nature, meaning the nuclear division has happened but the cytoplasmic division has not taken place in case of benign tumor. Whereas in malignant tumor, the mitotic activity is highly present, it's abnormally present, it's atypical in case that can be tripolar, quadripolar, multipolar, meaning the nuclear division is so rapid there is no time for cytoplasmic division. So mitotic figures are a characteristic feature of malignant tumor, though in benign tumor we can see some bipolar nuclei. Next difference includes the tumor gate cell or the tumor giant cells. They are absent in benign tumor, but tumor giant cells are present in malignant tumor. What does it mean by saying tumor giant cell? It just means a large cell with multiple nuclei within it. It appears like a giant, therefore it's called tumor giant cell. The possibility of getting into a tumor giant cell is that few authors believe that multiple tumor cells are fused to form tumor giant cells, whereas a few other authors believe that the mitotic division is so rapid, the nuclear division is so rapid, the cell does not have time for the cytoplasmic division. Therefore, it becomes really huge with multiple nuclei within it. That is another theory how the tumor giant cell is formed. Next difference, nucleus cytoplasmic ratio. Normally, the nucleus cytoplasmic ratio is 1:4 to 1:6, meaning if nucleus is 1 millimeter in size, the cytoplasm will be 6 times of that of the nucleus. That is a normal. In benign tumor, the nucleus cytoplasmic ratio is normal, whereas in malignant tumor, the nucleus cytoplasmic ratio is increased. In such a way, the nucleus occupies almost 50% of the cell. So the cytoplasm and the nucleus is 1:1 ratio. Now also it gives a angry-eyed appearance, like owl's eye or a buffalo's eye, like a dilated pupil. So in various tumors, in malignant tumor, they'll describe like this: angry eye, owl eye appearance, buffalo eye. They just want to scare you by telling malignant tumor, different eye appearance. It just means the nucleus is increased in size. It has become as big as half of that of the cell. So nucleus cytoplasmic ratio has become 1:1. That is the meaning of increased nucleus cytoplasmic ratio. Next difference in polarity. So polarity is maintained in. So what do you mean by polarity? I will give you an example of stratified squamous epithelium. If a tumor is arising from stratified squamous epithelium, we can still make out that it is coming from stratified squamous. Basal columnar, next polygonal, next granulosa, then cubical, then lucidum, then corneum. Like that, layers are maintained. The polarity is maintained. Where the columnar cell should be there, it is present still over there. Where the squamous cell should be there in the superficial most, it is present there only. So the polarity is maintained in case of benign tumor. Whereas in malignant tumor, the polarity is lost. The meaning of that is we don't know which cell was basal and which cell is superficial. So the polarity is lost in case of malignant tumor. The next difference in case of microscopy is chromosomal abnormality. The chromosomal abnormality like trisomy, disomy, monosomy, various difference, depletion, deletion, okay, isochromosome, ring chromosome, all these kind of chromosomal abnormality is absent in case of benign tumor, but usually present. Some kind of chromosomal abnormality is present in case of malignant tumor. So this is the summary of the microscopic difference between benign and malignant tumor. To summarize, you should know the difference. These 10 points: differentiation, anaplasia, the nucleus, the color of the nucleus, the nucleolae, pleomorphism, mitotic activity, tumor giant cell, nucleus cytoplasmic ratio, polarity, and chromosomal abnormality. Coming to the gross difference between benign and malignant tumor, the capsule is usually present in benign tumor. The borders are well defined and the local invasion is absent. So whenever you see in gross histopathology in gross, so if there is a well circumscribed spherical mass, well defined mass without invasion to the neighboring area, then area of necrosis and hemorrhage are absent, metastasis is absent, that means it's a benign tumor. Whereas a malignant tumor is like this, where the tumor cells are proliferating into the surrounding area, so they are not well defined. There is no proper definition of where exactly is the tumor. It's spread into the neighboring area. The tumor has invaded into the neighboring normal tissue, so it's poorly defined. It doesn't have a capsule. Then local invasion is present. Then characteristically there are some cavities, hemorrhage, necrosis. Like this, some cavities are there. Central cells of the tumor are going to die due to lack of nutrition. So there forms a cavity, necrosis. Then some bleeding spots will be there, hemorrhage. So all these are present. In fact, metastasis also is present. Local and distant metastasis is present in malignant tumor. So if you take a cut section of tumor, if you see a homogeneous white or gray color, uniform color, that is benign tumor. If you find like it has got multiple colors, areas of cavity, hemorrhage, necrosis, multiple pleomorphic features in gross, that means it is a malignant tumor. Metastasis is absent in benign and obviously present in malignant. Then clinical features are very few. It is based on local symptom of the tumor, because benign tumor grows very slowly, the rate of growth. Local invasion also is very less, except pressure symptoms. It may press on the blood vessel, decreasing the blood supply to that area. It may press on the nerve, causing some paralysis or paresthesia. It may press on the underlying bone and erode it. That may be the local symptoms. So the clinical features are very few in benign tumor, unless the tumor is really large. And the rate of growth is also slow. So some patients for 20 years they will have benign tumor. The prognosis are therefore very good in case of benign tumor, whereas the malignant tumor, because of the rapid growth of the tumor, there are many symptoms. In fact, the symptoms are due to local invasion as well as metastasis. So symptoms based on metastasis, if it spreads to the lung, the patient may have hemoptysis or coughing out of blood, spreads to the GAT, vomiting of the blood, melena, black tarry stool, spreads to the brain, the patient may get stroke, spread to the spinal cord, the patient may get symptoms of localized lesion of spinal cord. So based on where it spreads, the symptoms are many in case of malignant tumor. Because of the local invasion as well as distant metastasis, the rapid growth of the tumor results in bad prognosis, meaning the tumor has got very bad outcome. The patient may have mean survival of less than 5 years or so. So this is in toto differences between benign and malignant tumor. Thank you for watching and learning from Logic Medico. If you like this video, kindly press the thumbs up icon and share this with your friends. So in summary, majority of the pathology is covered up here. You can write up these things in your examination. Whenever the question is asked on any tumor, all that you have to know is whether it is benign or malignant, and remember these columns and write appropriately. So in pathology, half of pathology is made up of tumors. So those tumors are summarized in this simplest explanation. If you're able to remember this and reproduce in the exam, then I will be the happiest person. Thank you for watching and learning from Logic Medico. Good day.